Welcome to the Grow Your Practice podcast. Hi, I'm your host, Chad Madden, owner of Madden Physical Therapy and Breakthrough. Join me each week as we dive into the best practices, systems, principles, tips, and tricks to help you grow your private practice.
Hey everybody, Chad Madden here with the Grow Your Practice podcast, and today we have a very special guest. Scott Gardner is a physical therapist, practice owner, and the founding member of the United Physical Therapy Association. Thanks for being here, Scott.
Thank you for having me. I really appreciate it.
Awesome. Let's start with an easy question. How'd you get started in physical therapy and become a practice owner? Can you give our listeners an idea of your physical therapy journey?
I graduated in 1996 with my master's degree. Worked in outpatient corporate physical therapy, decided to move to a private practice outside of Ocean City, Maryland around 2000. Practiced with them until about 2011 and figured I'd like to go out on my own and try being an independent practitioner. I did that for about 4 to 5 years. I had a heart attack at the age of 42. And that really made me kind of think twice about what I'm doing here and did I really want to be independent? And I did, but I also wanted to be a part of a network. So I decided to join physical therapy and balance centers, and that helped me grow my network and get to meet a lot of great people. And that's where we are now. So I've been a franchisee for about 8 years. And then just recently, my daughter got accepted into physical therapy school. She's going to my alma mater at UMBS,
Nice.
which is awesome. And I'm proud of her. And that's where we are. That's my background in physical therapy. I've been outpatient for 28 years. So as you can tell by the hair, I'm up there in age. I'm 52.
All right. I'm in the same ballpark. I'll leave it at that. Now, I followed I think it was one of the first couple hundred members in the United Physical Therapy Association group, the group that you started. Before I get into why you started that, I just want your take on what's going on at a national level with healthcare. What are the changes that have happened during the last 28 years as a profession? And I'm talking on this as well. So happy to fill in the blanks with any statistics or anything like that. But I'd be interested in what's your viewpoint on what you see happening with reimbursements, with cost to deliver care, with the future of physical therapy. You mentioned that you have, a daughter who's going to be a future physical therapist as well. What are the trends that you see and really the impetus for starting the United Physical Therapy Association?
Well, about a year ago, I decided I wanted to get into more advocacy and start doing my research. You can find out almost anything you want to online nowadays, and started researching why we are where we are. And there's a lot of regulations and laws that have been passed that have kind of brought us to this point over the last 3 decades. And what you really start to see is when you open your eyes, you see a lot of consolidation going on. You notice that the small town hospital that was in your neighborhood is now part of a bigger system, a healthcare system, not a hospital, a healthcare system. All your independent practitioners, your physicians they're kind of falling away and they're being gobbled up by these systems. And when you start to realize, why is that happening and how are they able to do that? Well, the reason is the payment rate for independent private practice is going down. And when a hospital system or a healthcare system acquires that practice, all of a sudden they flip the name on the door and the payment for the same service, because it's site specific, is now 3 to 10 times more. For example, you can get an MRI at the hospital, $2,800. You can go to a private practice, radiology practice, and it might be $500. But customers don't know that. Consumers don't know the difference. And I see that going on, and I see it in my state, and it's every state. And then you realize that these systems are nonprofit systems that are raking in tens of millions of dollars. I'm not talking about the small rural hospitals. They're still struggling. But the large systems are overtaking everything. And then when you look at that, it's like, why are my healthcare premiums going up every year? They've expanded for my personal family to about $35,000 a year if you include my deductible for my family of 4. Why is that up about $15,000 to $20,000 just in the last 5 to 6 years? And if they're not paying private practice more, where's the money going? So then you start thinking, well, maybe it's because they're paying the healthcare systems more and we don't have site neutral payments. And then you start delving more and you see that there's a medical loss ratio where they have to spend 85% of all revenue brought in from premiums on healthcare services for their members. And that sounds great. And then you also see that United Healthcare started to vertically integrate to make it work for them. And they do $100 billion in revenue in a quarter, only at 6% profit, which is still $6 billion.
Yep.
The more they can charge, the more they can make. You start seeing this and say, something's wrong with this picture. And honestly, one person like myself cannot fix it. But I think if we unite, and not just across physical therapy, but across all associations that are dealing with this, we need to speak up and say enough's enough, because we need to protect our ability to be independent practitioners, as well as our patients who are paying more for services than they really need to be. There's no reason, for example, an MRI should be $2,800 when another practice can do it at $500 and make a profit with it. That was really what kind of got me started in all this. And the more I research, the more I get into it. And I'm at the tail end of my career, and I've like another 10 to 15 years to go. And if you would ask me 25 years ago that I'd become a health policy advocate in physical therapy, I would have said no. But I do find it interesting, and I think our profession has an opportunity to make a difference. But the problem is we're just altruistic, and we need to stop being so altruistic all the time. We have to take care of ourselves in order for us to take care of our patients. And if we don't take care of ourselves, we all burn out. As you see in our industry, everybody's just burning out, and that's not good.
Tell me more about so I'm glad you brought up that, and I had read that quote somewhere. I think I had read an interview from you, or maybe it was on the website, about altruistic, or the altruism that we all have. The way that I've always talked about it is innately most of us are very relationship oriented as clinicians, where we would probably give away care, right? Do pro bono work, waive a copay or deductible or whatever it is. We would give our staff whatever, we could afford to pay them. That's just how we're oriented. Most of us are very poor at the other end, the balance, which is practice math, right? We're just trying to keep our doors open. But can you tell me more about how you think through that altruism, what you see amongst our profession, and how you think through that?
We're just too nice. Every one of us went to school to take care of people. We're a compassionate profession, and that's why we're here. And honestly, I think if you look at it, the insurance companies know that, and they know that they can just keep lowering our rates, and we'll just keep saying yes, because we want to advocate for our patients, right? We want to take care of Mr. Smith or Mrs. Smith. We can't let them not get the care they need. And there's nothing wrong with that. But at the end of the day, we've taken too many cuts. And we're like the giving tree, if you remember that book, where the tree just keeps giving and giving. And at the very end, it gets sat on. That's all it had left to do is get sat on. And that's where we are. We have to stop. We have to start advocating for ourselves more. And our best advocates for us are our patients. And I think we need to really get them mobilized to help us achieve our goals. I always tell people, like, if we're trying to get something done legislatively, a legislator is concerned about their constituents and the money they get for their campaigns, probably. That's probably the two most driving factors. They want to make sure their constituents are taken care of, and they also want to stay in their position because they like being a legislator. We need to rile up our constituents within an area and get them to really speak up for us, because our patients, you know it, Chad, how many cookie trays do you get in your practice? How many cakes are brought in saying thank you? How many pizzas are bought for lunch for your staff, right? Endless. They love us. And we just need to channel that energy and get them to help contact their congressperson, write emails, things like that.
Complete alignment here, Scott. I'll just throw some figures out for you because I look at it as well. CMS.gov for all the listeners, invite you to go there and just get into the government shares data on what's happening with healthcare. I've seen the EOB's 3X payment, not only in our area. I know one practice that was just acquired, they were getting $71 a visit. The second that they had the new name, it was $216. That's a 3X for the same exact visit provided. 4.5 trillion spent in the U.S. in 2023 on healthcare. 72% went to hospital and healthcare systems. The majority of that went for medications, injections, surgery, diagnostic imaging. That's 72% of that. If you break down the 4.5 trillion, it's $13,500 per person per year in this country. That is a crazy number.
Right. That doesn't need to be that high.
Exactly.
It doesn't need to be that high.
I know the one statistic that really bothered me is AMA estimates that 25% of prescribed medication is unnecessary or unneeded. That number is $151 billion a year. That is more that is spent on all of conservative care combined. That includes PT, outpatient PT, OT, chiropractic care, podiatry, dentistry, optometry. That's the 7 industries, professions that CMS considers conservative care. You talked about laws, 2 things, legislative branch and government, and then advocacy with insurance companies as well. I know for at least on the podcast, we've had owners that have renegotiated rates. The 2 biggest publicly traded places where we can look for insurance companies where we can look at data are United, which you mentioned, the $6 billion that they just had in a single quarter in terms of profitability earnings. And then also Aetna, which is owned by CVS.
Right.
They have data available as well. We've had owners on that have either dropped going out of network with United or renegotiated rates in a few instances. But when you're talking about advocacy, where do you think, and I completely agree with the patient, where do you think our best bet is where we can hedge our efforts? Is it with legislative and we get things passed through government, or is it by going directly to the insurance company?
I don't think going to the insurance company will matter personally. Per many stories, unless you're extremely large, most likely you're not going to receive any type of increase from an insurance company. I think if you look at just what happened in Texas and Tennessee, they just passed a law that any cash-based service gets applied to your deductible. So let's use the MRI as an example. I go to the hospital down the street. I've got a high deductible plan, which many Americans do nowadays, and it's $5,000 per individual. I go to get the MRI. I don't know the cost, and I just get it at the hospital because that's where I'm sent, and I get a bill for $2,800 from Hospital A, and that's on my deductible. And I'm like, that's a lot of money. I really can't drop that right now. Meanwhile, if I'd gone down the street to the independent MRI facility, it might be $500, and I can negotiate a cash price because it's supposed to be transparent of what the prices are. But before, if I paid cash and I did that, it wouldn't be covered on my deductible. It wouldn't even apply to it. It would just be, tough luck. You did it on your own. It doesn't get to your deductibles. Tennessee and Texas just passed a law that any cash service you have gets applied to your deductible. That being said, if you're a physical therapist and you're a phenomenal PT in your area, and you know you are, now you can set your prices. And you can say, we charge $120 an hour, $125 a visit. And the patient can elect to choose where they want to go. And they can choose a place that charges less, or they can choose a place that charges more. And maybe the place that has more experienced therapists that have more knowledge in what you're being treated for. Right now, you get a cheeseburger at a fast food place and it's the same price. It's the same burger, but at different locations, you're paying more for it. It'd be like buying a cheeseburger at McDonald's. You go eat it at Ruth's Chris, but you're paying Ruth's Chris prices for the cheeseburger that's the same at McDonald's. That's what healthcare is right now. It makes no sense. So if we have some transparency, I think a legislation like that can make a difference, because then the mindset of the patient, the consumer, shifts to I got to find the best price with the highest quality. That's going to create competition to make some facilities up their game to be able to succeed. And I think that's where we're at, because the private practices that are succeeding have found ways to be successful in this climate, to provide quality care to the patient, in a facility that leverages technology, customer service oriented, and great outcomes. I think that's a pathway forward for all of us. If that takes fire and goes across the nation, that's just one way. But of course, we can't opt out of Medicare, and that's a whole different story. We would still be beholden to what Medicare pays. We need to continue to advocate for Medicare. And what's interesting is the RUC is the committee of 32 members volunteer that decide what these codes are worth and recommend to CMS their values based on the 3 categories. And the expense value for physical therapy has never changed in I don't know how many years. The CPT codes are low value for what we do. And we have a member that's a physical therapist on there, but I guarantee if everybody listening to this podcast, I bet you maybe one person can tell me the name of that person that represents our profession on that committee of 32 people. I bet you nobody in this podcast will name that person. And that person, if you ask me, we should all know, because that person speaks for us in that room when they meet to value codes. And none of us know that person's name.
That's a shame. Physician fee schedule, you graduated in 94, I think is what you shared.
96.
Okay, sorry.
The beginning of the end.
I know since 90, the physician fee schedule for therapy is less today than it was back in 1994 for that is brutal when cost is more than doubled to provide care. And then if you go back to 2000, it is down in the last 16 years, it's down 14%. Now, I know there was a new ruling that was finalized November 1st. I've read this from a couple different outlets. Is it a 2.86% increase or a decrease that we're getting next year?
No, it's a decrease. It's another cut.
Okay, great.
And there is HR 10073, which has been put out there for legislation to basically reduce that cut to zero and give us a 50% raise based on inflation. Instead of us getting a 3.2% increase, we would get reduction of the 1.8, and I believe it's like 1.6 raise. If you think about it, if that actually goes through, we just get recouped what we just got cut for 24. We go back to the rates that we had in 23 for 25. It's a win, but I mean, if we can get rid of a cut and give us a bump, I'll take it. But that's where, it's ridiculous. 1.6%, what's that when inflation's more than that? But
inflation since 2019, only because I just looked it up, is 32.5%.
And what's our cut in Medicare over that time? In the last 5 years?
It's high.
It's terrible.
It's brutal.
Because we don't advocate, and physicians don't advocate. That's the problem. We have to be advocates. We just can't sit in an echo chamber on social media and complain.
Yeah,
that does us no good. We have to start speaking up, and that was the reason why I really wanted to start this association, because I feel there's a voice that needs to be more advocacy related for our profession. And I think we need more people to get involved from an advocacy perspective. And, you can give me your time, you can give me your talent, or give me your treasure. Those three things are what we need. And I don't pretend to have all the answers, because I don't. I'm a rural physical therapist in Maryland. But I just saw that the voice is missing. And our current professional association does advocate for us. Don't get me wrong. But I think we should do so much more than we're currently doing. Yeah. And that's why I'm here.
Let's get into that a little bit. Legislative branch, completely agree. Scott, I think that's the best route. On an individual practice basis, we've seen some practices be able to grind and negotiate. We put out a booklet at the association event and have made that available. And it's basically, we've found, here's what therapists are doing to renegotiate better rates. And we just share that with everybody for free. Legislative, what does that look like? Before you answer that question, if somebody's listening to this right now and they're like, I want to do something, how can they learn more about the United Physical Therapy Association and how they can get involved, whether it's time, money, resources, et cetera?
We have a Facebook page, United Physical Therapy Association.
Great.
Please join it. I will post comments from people on the page to just develop dialogue. It'd be funny sometimes the people that hop on there and you're just like, well, I know that I recognize this name. And if you want to check us out, unitedpta.org, to kind of get a feeling for what we're about. We are advocacy, 100% advocacy. And we need members, and we need the dues from the members to help us achieve what we want to achieve. And it's not going to be an easy task, but what I want to do is get enough members so we can set it up by settings and have people underneath each setting to drive conversation, whiteboard ideas of how we're going to go about making change. And there are a lot of intelligent, well-known people in our industry that can help us out. Yeah. And like I said, I don't have all the answers, but I want to just help be basically the rocket to get us up and lifted so that we can start having these conversations. We need to listen to everybody. There are 40,000 physical therapists in the United States, and 165,000 aren't members of our association. And there's 111,000 PT assistants, and about 100,000 of them aren't members of an association. There's a lot of people out there that are just practicing, that just kind of hanging out there. And we need to capture as many as we can to make a difference. Check us out on the web. And feel free to do the contact me page. It all goes right to me. I'll gladly Zoom with anybody. I'll gladly talk to anybody to see what we're all about. We're just trying to make a difference. That's all we're trying to do.
The how-to is where I think I might be able to help you out a little bit. Like off the top of my head, last 20 years, where have you seen successful advocacy? I think for many of us, you mentioned, belonging to an association, many of us are jaded. I know I've written a check or two.
Right.
And I'm like, well, that didn't work at all. I'm interested in how you're thinking through that. The one thing that I can help you out with is I know like Katie Britton, Carl Klein Peter had major legislative changes down in Louisiana where they had some really big wins. I can introduce you to them. Are there any others that stand out? Like where have we seen meaningful change amongst private practice PT in any of the 50 states or DC?
I know we have wins, as they call them.
Yep.
I don't know how many that really we would consider a true win. For Maryland, for example, we got prior authorization pushed through this past year, and you have to work in conjunction with other associations from multiple disciplines to get something done. So the prior authorization bill goes into effect January 1st. And if my memory serves me correct, I think an insurance company has 48 hours to give us a yes or no. And if they don't, it's automatically approved. Keeping track of that and how if an insurance company is actually doing what they're told will be an issue. Obviously, you'll have to figure it out, but that's a win. That should reduce administrative burdens. But at the end of the day, it doesn't change reimbursement rates. And a lot of things are going to happen at the state level, but I think everything trickles down from Medicare. Just look, Medicare makes 15% PTA differential, and all of a sudden, lo and behold, all the insurance companies are deciding that that's a great idea. And they're cutting a PTA differential by 15%. Now, what was the impetus for them doing that? Was there any study that they did that showed that it would be great if we just cut it 15%? I know in Arkansas, I think they just started adding MPPR into them just because they can.
Before we continue with this episode, here's a word about our course, Profitability Under Pressure.
How does your practice's profitability today compare to what it was back in 2019? Is it keeping pace with inflation? Hey, this is Chad Madden here. I want to introduce you to the Profitability Under Pressure program. This is a 90-day masterclass designed to help you build a robust financial system for your practice. Most owners aim to improve revenue per visit and enhance their bottom line. However, many are facing declining reimbursements and rising operational costs, making it challenging to maintain financial health. The Profitability Under Pressure program consolidates the best practices currently working for practice owners into one comprehensive system. This program will help you boost profit margins, reclaim your time, gain time freedom, and assist more people in your community and leave a bigger impact. You'll learn how to conduct a profit leak audit, create a profit plan, and use various levers to increase revenue. Additionally, you'll get a 90-day trial of our patient demand software and access to our exclusive Inside Circle community. Here you can connect with other like-minded practice owners who are navigating similar challenges and finding solutions. Don't just take our word for it. Hear from owners like Lance Gross, who added $1.1 million to his bottom line, Peg Gray, who got her finances under control, and Jeff Gersh, who saved time with our cheat sheet for increasing profitability. Don't miss this opportunity. Apply today for the Profitability Under Pressure program and start increasing your profits by $10,000 or more within just 90 days of implementation, guaranteed. Secure a more stable financial future for your practice. Click below and apply now to join the ranks of successful physical therapy private practice owners who transform their businesses with our program. Apply today.
Thank you for listening this far. Now back to the episode.
We need to find people that have knowledge of the inner workings of legislative, how things work in the legislative process, people that are familiar, making relationships with legislators, things like that. How about we get to know the person on the rock? How about we all get to know the gentleman that sits on the rock?
Who is that?
Richard Rouse. Richard Rouse is the gentleman that has been on the ruck since 2020. Since 2020, we've taken a 13% cut in our Medicare. Now that's across the board. I know it's the whole fee schedule for everybody, but every code, as you know, goes up and down in value.
Yeah.
Some get valued more, others get valued less. But like, what's that gentleman doing? I'm sure he's working hard, but why? How can we help him? Like, how can we get the data, the questionnaires to us? Like they say, be on the lookout from a data from AMA. I mean, a questionnaire from AMA about the RUC values in your practice. I've never gotten one. Have you gotten one?
Zero.
Right. Who are we sending these to? Like send them to people that are really, truly in this, that are practice managers that understand what's going on. We can tell them what our issues are and where our problems lie. Because what's going to happen is if these health systems keep taking over everything, they're going to be able to pay your therapist, Chad, about $25,000 more a year.
It already happens. We just lost 4 in 30 days.
Right. And it's like, there's nothing you can do. And it's like, until people start speaking up and saying enough's enough, it'll just keep happening. That's where we're at. And maybe, I hope to promote that gentleman's name on our Facebook page and maybe try to reach out to him and say, how can we help you? What do you need from us to advocate more for us on that committee of 32 members?
Magic wand. You have 10,000 members. You're taking the fees from what I can see online, from what you've shared already. The vast majority, a greater percentage of that money will be going straight towards advocacy. What does that look like? Are you hiring lobbyists? Are you? What's
so $149 for a PT? There's obviously some admin costs to run the website, fees for credit cards, things like that. But this is an entirely volunteer association, and of course, if it grows exponentially, you're going to have to hire somebody to be the executive director. I can't be an executive director, president, run my clinics, and do everything else in that. I just don't have that bandwidth. But if we have 10,000 members times $149, that's $1.5 million. We hope to use up to 80%, basically as much as we can. And that's right on the website. When you sign up, it tells you that in your membership agreement, towards advocacy efforts. The first thing we want to do is get our own lobbyists and somebody that can be in touch on the Hill, tell us what's happening, what the rumblings are going on behind the scenes, and be that advocate for us, set up meetings with Congress, legislators in Congress. But that's not cheap. That's going to run about $250,000 a year to have that access. And that would give us about 6 or 7 lobbyists to work with the UPTA and to work with PPS and to work with APTQI. The more we have, the more access we have, the more times they have to listen to what we're talking about. That's the first step. Then after that, it's about making connections. We get these members in our association. Who do you know? How can you get us access to this person? Where do we need to go? Do we have to do a separate PAC at some point where we can raise money? And the thing is, when we do a PAC, if and when we get to that point, we want to be transparent. Chad, you give me $1,000 for the PAC. I don't want you to think you just lit the money and put it on fire and you just gave it to me. I'd say, Chad, here's what we're going to do with that money. Would you like to be involved? And I would love to have somebody like you involved to go to your legislators in Pennsylvania in your district, your representative in your district, and say, hey, there's a dinner coming up. We'd like you to go chat with the legislator and tell them what's going on. So you can have it, things like that. That's what we want to be. We want to be transparent where the money's going. And then we want our members to be involved, not just to write a check and say, I gave it to the PAC and I don't know what they did. And of course, we don't want to be partisan. We're going to advocate for the profession, whether it's a Democrat or Republican. If they're supporting what we support, we want to be there and support them too. We're never going to be 100% aligned with everybody, but at the same time, I don't want to be a partisan group or come across as a partisan group. We're about the profession, and we are about advocating for the profession, and that's what we're here for. Hence the word united.
We're here in Harrisburg, and we do get to treat quite a few legislators, which is pretty cool. Never really thought about advocacy that way. I know Paul Welk has mentioned that a couple of times that came in handy, that legislators had positive experiences. Love that. I will ask you a slightly political question. There is Kennedy has the Make America Healthy Again. That really grabbed me, only because I do look at the CMS.gov numbers and know what we're spending in healthcare quite a bit. And that's, was a Democrat, now is on the Republican ticket or the incoming, I don't even know what to call that, incoming party, I guess.
Incoming administration, right?
Thanks.
You're nervous. I get it.
Well, I mean, it's a very touchy situation, but when I read what he's saying, a lot of it makes sense. We eat horribly, we don't move, and that's why we have, all these problems as a country, especially in chronic care conditions. Is there anything along that you've read from him, or any, like, what's the hope for us in the future? Is anybody on Capitol Hill going to pay attention to this and like really care about the health of our country, which is what I think physical therapy represents in terms of the best outcomes per dollar within healthcare in general?
100%. And we need to reach out to him. And I plan to send something too. And I was waiting for the election to see what happened. I'm going to reach out to him and just as the association president and say, hey, we would love to sit down with you and chat about how physical therapy can make a difference in people's lives. I mean, he wants to get rid of seed oils in our foods and think about all the dyes in our food. I was just over in Europe for the first time ever 2 months ago, and the food just tasted different over there. I went to a Starbucks over there and it didn't taste the same. But you could just tell it wasn't as artificial. Things tasted just more natural, if I could say that. I mean, I think he's got some great ideas, and I think we need to reach out to who's ever going to be there for us. And I mean, have you looked at the gentleman? He's 70 years old. He's in great shape.
Yeah.
Obviously he's taking care of himself. And if he wants to make America healthy again, I'm for that. That's what we're all about. We are, non-surgical, specialists of the human body. I mean, that's our wheelhouse. We should be front and center in his office saying, how can we assist you in making America healthy again and decreasing the healthcare expenditures in this nation? I mean, look at a Medicare Advantage, how much they've taken advantage of the government over the last few years of $83 billion in upcoding. And if you take that $83 billion, you could basically fix the fee schedule for a year. There's a lot of issues out there. I mean, I can't cover them all in the podcast, but I think we need to reach out to people like that. Partisan politics aside, we are physical therapists. And you may not agree with some of the stuff he says or the administration coming in, but we need to do something. We need to be involved.
Yeah. One more issue. You mentioned your daughter. She's going into PT school right now.
Correct.
I cannot find a source for this, and I can't remember who said this, but I heard it and it rings true to me. The greatest disparity between cost of a degree and value in the workplace in terms of salary is physical therapy.
I believe it.
I know within the UPTA Facebook page, there's a lot in there on educating students on financial economics of healthcare, and there's, we'll call it, a differing opinions on either side there. I've done this, Scott. And we're about to do it again, but I host a private session in this office for graduating DPTs every year, and we talk through graduating students, no idea about what has happened with Medicare cuts, no idea about the cost to provide care. They just are completely not, that is not covered at all in most academic programs. What do you see as the solution there? How can we narrow the gap on disparity? I mean, DPT degree, we had a student come through, or an entry-level DPT with $300K in student loans.
That's crazy.
It is nuts that the same government that now controls Sallie Mae and Freddie Mac are the two biggest.
They allow those.
Yeah, they allow that, but yet they're also suppressing the amount of value that same DPT has in the world through reimbursement rates. How do you marry that up? How do you think about that? And how can we solve that for future generations? You have kids, I have kids. I mean, there's going to be future physical therapists that we're going to need to take care of us, as our generation ages as well. What does this look like?
Well, if you think about the degree, I went back and got my transitional doctorate in 2007 under the assumption of Vision 2020 that we would have all this access to all these patients. And, most of us have direct access now, but it doesn't really mean that we're getting paid more. Outside of going back to a bachelor's degree for our profession, which if it was still a bachelor's degree, the ROI would be okay. It would probably be in line with what you got when you had a bachelor's in 1994 in terms of your starting salary. I mean, until colleges decide they don't want to charge as much for these programs, that'll probably never happen as long as kids are coming into it. I think the thing is when we get them into school, that's our best time to make a difference in their life outside of school. You have 2 to 3 years to really work with the student to get them ingrained in what's going on in the real world. And if you ask any of your students when they come out, they can name all the social determinants of health and barriers to care. They can just rattle them all off because that's what's being taught to them. Then you say, like, how much do you think I'm getting for this patient right here? And I've heard anywhere from $200 to $150 a visit. I was like, no, we don't get that much money. And they're like, really? I think it's important that we have business classes in the DPT program, and that's going to have to go through CAPTE. And CAPTE is underneath the umbrella of APTA. We need to get that changed, that there's true business classes from all settings taught by people that actually work in those settings for them to understand. Because if they come out knowing that the situation is what it is with reimbursement, maybe they'll be a better advocate for it as opposed to coming out $250,000 of debt, burning out in 2 years and saying, I'm done. And that's what's happening. They just get out of it and say, I got to make some money doing something else. Now the profession's losing people. And you and I both know it's like, you can't find staff when you try to. And then when you do, they have this misconception that I'm seeing one person an hour for a full day. You know? And it's like, it's just not sustainable. I don't know how. We have to get with the academia part of physical therapy, which represents 1% of our profession, but represents 7% of the APTA and represents 40% of their board. Do that. How does that make sense? 1% of a profession has 40% of a board that has fiduciary control over what goes on in our only professional association. That's one of the reasons I start thinking, like, we need another one. We need a different one that can speak for you and I and all the people practicing every day, because they're making decisions and they don't really have skin in the game, if that makes sense. They're not living the life that you and I are living and the therapists coming out of school living. They'll say they're practicing, but if that's not their primary method of making a living, then it's a side gig and they're keeping their hands in it and involved. But we need to have more clinical people in positions of leadership that can be like, hey, I get what you're coming at from that perspective, but right now we need to fix this. And then we can focus on that. And I don't, until we get everybody together and in a room and say, we got to fix this, it won't get fixed. But I think if we can apply outward pressure to an association that is relatively large, we may be able to make a difference. And that's why I want to get more and more members, because the bigger we are, the stronger our voice. We're not replacing the current association by any stretch of the imagination. I'm looking to capture the 150,000 PTs that aren't members, that are disenfranchised with that, or ones that aren't happy in the current association that want a different method to advocate. And then if we grow and we're 10,000 members strong, we're going to work together with them. And we're going to be able to help, say, hey, let's turn it this way slightly over to here. 43% of us are working in outpatient right now. 43% of the practicing therapists are in outpatient. Let's focus on them. Let's focus on this.
The one thing that I've thought about a lot with the student, the cost of degree, wages, average salary in the workplace disparity is if the government limited on what we could borrow for education, the prices in education would come down fairly dramatically. I think since 2000, they're up 300%, the cost of the degree. I know when I went through school, the maximum I was allowed, and I'm in the late 90s, same era that you are, Scott, the maximum I was allowed to borrow for my 5-year MSPT degree was $24,000. And, first job was, I think, 41 or 44,000.
Yeah, I had 38,000 my first job. And if you put that into inflation today, it's upper 70s. And that's what I'm saying. Like, the degree back then as a bachelor is making upper 70s. That's not bad. I tell students that come through that want to be PTs, I say, stay in your local state and go public. There's no reason to go to a private school to get an education. It's just absolutely no reason to. You're going to, as long as you learn the material and you pass your board exam, you're a physical therapist. No matter where you went.
I had shared with you that we had a few owners contribute questions, and there's a common one that I want to ask just to recognize. Somebody submitted 12 questions, I think.
Holy smokes. Just tell them to call me. I'll gladly talk to them.
I'm going to do one, which is how does United Physical Therapy Association think about photo or other clinical measurement tools regarding insurance companies or anything around functional outcomes? How are you thinking about that? I know, with Medicare we had PQRS and some other
MIPS.
Exactly. How are you thinking about that as an association and attacking that?
I've used photo, and
you can talk about whatever functional measurement tool you want to talk about.
I've used photo and I found it to be cumbersome and just adding to especially we're more of a balance center, and a lot of the outcomes that they have for that weren't really designed for vestibular imbalance. I think it's important that we show progress functionally. I also think that we need to delve into the AI aspect of it more.
Yep.
And start using technology to our advantage. These insurance companies are just adding more and more layers of administrative burden for us to see a patient to get them better. We really need to find platforms, work with industry leaders that bake all this stuff into an app, and say we put our phone in our pocket, measures gait speed, fall risk, things like that. Sit to stand, timed up and go, what have you. Generate the data. Put in a functional outcome score that's been valid and measured to be valid and reliable, and put that in there and just keep track of it that way. We need to leverage technology to make our lives easier. They're just trying to make our lives more time like this. And we just got to find easier ways. I personally didn't find photo to be very user-friendly in my practice. Nothing against the platform, just didn't work in my business. But we just need to advocate. What is think about the functional, what was it, G codes? Was it the G codes? Remember that all those years we did the functional G codes? And then after 3 years, they said, this data is just useless. You and I probably spent about, 3 weeks of our lives plunking in these G code numbers for no reason. We need to have a seat at the table. When people come up with these ideas of what we should do, we have to be vocal and say, this makes no sense. Why don't you come to a practice and watch us treat and see if all this stuff that you want us to do actually makes sense. Look at MIPS. I do MIPS. There's questions I can't address some of those issues in my session of therapy, but they need me to do it because if they don't, they're going to give me a penalty. And that's just another way to strike down the independent practitioner and to favor the large systems. We just need to speak up. And that goes all back to altruism, because we just let them keep doing it to us. And we never say enough's enough. And we just have to eventually say enough's enough. And that's what we need. That's why I'm here.
Awesome. Just for everybody, we'll put this in the show notes as well, but it's United PTA, Physical Therapy Association. That's unitedpta.org is the website that you talked about earlier, Scott. And then also, if you search UPTA on Facebook, the page comes up right away. The icon
That's good. Means we're getting a lot of hits.
Is a American flag, 5 stars, and I think there's a reason behind that as well on the UPTA Facebook page. You can check that out. Lots of activities in there. Again, I've been following the conversation for quite a while. Scott, this has been awesome. Thank you so much for being on. I have one final question for you. I lied before. Most influential book as a private practice owner that you've ever read?
Chad. It's going to sound crazy.
Yeah.
But it's Who Moved My Cheese?
Spencer.
Who Moved My Cheese? That's the one that really got me thinking about, if we keep doing the same thing over and over again and keep going to that well over and over again, it's eventually going to run dry. And a simple book, simple meaning, but really got me thinking, wow, we need to find the new cheese. And where is that located? So.
Awesome, man. Love it. Thanks again, Scott, for being here. This was great.
Thank you, Chad. I appreciate your time, and have a great Thanksgiving.
How does your practice's profitability today compare to what it was back in 2019? Is it keeping pace with inflation? Hey, this is Chad Madden here. I want to introduce you to the Profitability Under Pressure program. This is a 90-day masterclass designed to help you build a robust financial system for your practice. Most owners aim to improve revenue per visit and enhance their bottom line. However,
Many are facing declining reimbursements and rising operational costs, making it challenging to maintain financial health. The Profitability Under Pressure program consolidates the best practices currently working for practice owners into one comprehensive system. This program will help you boost profit margins, reclaim your time, gain time freedom, and assist more people in your community and leave a bigger impact. You'll learn how to conduct a profit leak audit, create a profit plan, and use various levers to increase revenue. Additionally, you'll get a 90-day trial of our patient demand software and access to our exclusive Inside Circle community. Here you can connect with other like-minded practice owners who are navigating similar challenges and finding solutions. Don't just take our word for it. Hear from owners like Lance Gross, who added $1.1 million to his bottom line, Peg Gray, who got her finances under control, and Jeff Gersh, who saved time with our cheat sheet for increasing profitability. Don't miss this opportunity. Apply today for the Profitability Under Pressure program and start increasing your profits by $10,000 or more within just 90 days of implementation, guaranteed. Secure a more stable financial future for your practice. Click below and apply now to join the ranks of successful physical therapy private practice owners who transform their businesses with our program. Apply today